Thank you, Mr. President.
Great to see you, Chuck.
Nice to see you. I will start with health care. It's probably the most quoted thing or requoted thing you have said in your presidency. If you like your health care plan, you can keep it. You said it a lot during the run-up. At this point, though, it's obviously something, a promise that has not been able to be kept. Just today, the Denver Post reported 250,000 people in Colorado are seeing health insurance policies canceled. Some of those people like those policies, and they can't keep it. What happened?
Well, first of all, I meant what I said, and we worked hard to try to make sure that we implemented it properly. But obviously, we didn't do a good enough job, and I regret that. We're talking about 5% of the population who are in what's called the individual market. They're out there buying health insurance on their own. A lot of these plans are subpar plans, and we put in a clause in the law that said if you had one of those plans, even if it was subpar, when the law was passed, you could keep it. But there's enough churn in the market that folks since then have bought subpar plans, and now that may be all they can afford. So even though it only affects a small amount of the population, it means a lot to them, obviously, when they get this letter canceled. And I am deeply concerned about it, and I've assigned my team to see what can we do to close some of the holes and gaps in the law, because my intention is to lift up and make sure the insurance that people buy is effective, that it's actually going to deliver what they think they're purchasing. Because what we know is before the law was passed, a lot of these plans, people thought they had insurance coverage, and then they'd find out that they had huge out-of-pocket expenses, or women were being charged more than men. If you had pre-existing conditions, you just couldn't get it at all. And we are proud of the consumer protections we've put into place. On the other hand, we also want to make sure that nobody is put in a position where their plan's been canceled. They can't afford a better plan, even though they'd like to have a better plan. And so we're going to have to work hard to make sure that those folks are taken care of.